this group, so we appreciate it. I'm going to start off my talk with just talking some about the long-term complications of TTP and some of the advancements therein. So without further ado, all right. So how do we diagnose, a thrombotic microangiopathy, or when do we suspect this in general? So typically you're going to need a few, key clinical features in order to be suspicious for an underlying TMA or thrombotic microangiopathy. And the first thing is going to be microangiopathic hemolysis, or essentially evidence of microscopic red blood cell destruction in the vessels. And you'll see that with schistocytes on the smear, evidence of usually a severe thrombocytopenia in the case of TTP, and polychromasia, so different cells at different ages. And then you'll also typically see ischemic end organ damage with the acute presentation. And in TTP, this predominantly will be affecting the heart, the brain, and or the intestinal tract. The kidneys can be affected, but tend to be less so than other types of TMA in general. So thrombotic thrombocytopenic purpura, or TTP, is an exquisitely rare condition. So it's about 1 to 3 per million per year in terms of incidence. And it tends to peak in African American women who are about 30 to 50 years of age, or in the third, fifth decades of life. Different conditions like pregnancy can precipitate episodes. And if left untreated, this is greater than 90% fatal. And so it's really important to have a high index of suspicion when a patient presents with this constellation of symptoms, and have a high degree of suspicion for TTP in general. So how does TTP occur? Typically, you have an enzyme called ADAMTS13. This is made by the liver, and this will cleave ultra-large von Willebrand factor multimers. And so these multimers are typically secreted by the endothelium as these long strings. And what ADAMTS13 is supposed to do is it cuts these down into normal physiologic sizes that are active at a physiologic level. However, whenever you have antibodies that either functionally inhibit or they may promote the clearance of ADAMTS13, you have an overabundance of these ultra-large von Willebrand factor multimers, and that can cause platelet ultra-large von Willebrand factor multimer aggregates, and these will form microthrombi in the capillaries and small vessels